Hi, I'm Dr. Bill Levin here in the Department of Radiation Oncology at the University of Pennsylvania Cancer Center. Here in the Department of Radiation Oncology, I mostly treat thoracic tumors, which is mostly lung cancer. I also treat sarcomas, which are tumors of the muscle and the bone.
I don't think there's anything to prepare for, but one thing that I'm really into is mindfulness meditation. And the idea of mindfulness, people throw it around a lot. And there's the meditation part and there's the cognitive part. They're both really important, but the cognitive part is the harder part. And what I think you can use before bad things happen, but when bad things happen and after bad things happen, is to learn to be in the moment. And I think, and I try to teach that to some of my patients who are going through a rough time, whether it's a rough time during the treatment, but many patients have a rougher time after the treatment, which is very interesting to me, but it makes sense. You know, when people get a cancer diagnosis, they go to surgery, have all these tests, they get chemotherapy, they get radiation, and they're busy and they're exhausted. But then when they're done, you're like, well, what's next? Well, we still do tests, but it happens periodically. And so people are twiddling their thumbs and they have too much time in their brain, right? So the idea of mindfulness, the preparation, if you will, is to learn to stay in the moment and not just sit on your couch in the moment, but do the things that you love, the things that are important to you. So, you know, that's a part of resiliency and a part of mindfulness is to learn to stay in the moment.
Hi, my name is Gabrielle. I'm a medical dosimetrist here at Penn. I've been here for 3 years now, and I have enjoyed every second of it. I'm behind the scenes, so you might not have heard of me before. I make the treatment plans for the patients on the photon side. You get to be a little bit more creative on the dosimetry side. You know, radiation therapy is, you have that patient aspect. That's like the number one thing about being a radiation therapist. Being a medical dosimetrist, you kind of get to use your mind a little bit more while still having a little bit of patient care aspect behind the scenes. Yeah, so my role in the treatment process of caring for the patient kind of comes after the consultation of the physician, the simulation of the patient. I am sometimes involved in the simulation of the patient if it's a little bit more complex of a case. But after that, I will get the CAT scan that is from simulation, and we come up with the beam arrangement or treatment plan. Every organ inside of your body has a radiation limit, right? So we have to make sure that we're not exceeding those radiation limits. And once we, have met those, we'll send it to the physician for approval, and then we'll kind of prep the plan for treatment. There is a lot of, we call it QA, quality assurance checks in place because we are treating patients with radiation in every aspect, photons, protons, brachy, electrons, doesn't matter. Quality assurance checks on my end, physics ends, therapies end, physicians ends. There's a lot of stopping power to make sure that nothing is reaching the patient unsafely.
Hi everyone, my name is Austin Kasai. I'm a medical physicist here at the University of Pennsylvania. So I chose to become a medical physicist because it combines my two loves of hard science with medicine. So it's really a joy to be able to use those skills every day to treat patients, and I'm very thankful for that. A medical physicist's job is to make sure the radiation goes to the right place in the right spot, and also make sure that the radiation that we're giving you is the exact amount. And we want to make sure that every process within the care path is successful and that everything is up to standard. At Penn, we have a variety of different technology where we're able to use photon, electron, proton style treatments. And we have computerized systems that are able to generate these kind of treatment style plans. So you're going to be receiving radiation from these big giant radiation generating equipment. And we need to make sure this equipment is able to precisely target your tumor in the exact spot. It's difficult, we know it's difficult, and that's why each one of us on the care team, we are truly in this field for the benefit of you, and every single day there's a lot of people on the front lines and behind the scenes that are doing the best they possibly can for your treatment care. And just know that, once you get through all this, there is light at the end of the tunnel.
Hi, I'm Angel Natal. I've been a radiation therapist at the University of Pennsylvania Hospital for 22 years. So I get to see them on a daily basis, meaning I literally get to spend every single day with them for their daily treatment, where nursing and or the physician only gets to see them once a week for their on-treatment visit or if needed for any clinical needs. There are a lot of concerns and misconceptions. For example, the patient is being used to be treated with a mask on their face for whether we're treating their brain or their head and neck area. They assume, per Google, that they are being bolted to the table when it's actually just a little clip that just clips in place just to hold the mask down. It can actually be easily broken. We just, do not disclose that to our patients, but a lot of them come in prepared thinking they're going to be bolted to the table, which is incorrect. A lot of them also think they're going to be burned from the radiation. They think that they're coming in and being microwaved or fried, and that is incorrect too. Now, one of the side effects is possible skin redness and or discoloration, kind of like if you were getting a sunburn or a suntan, but we are actually not burning anyone or frying them or cooking them. So that is probably the biggest misconception to radiation. I'm gonna give you a tattoo today. It's just gonna feel like a little stick. Okay. You will not feel anything out of the norm, and it should not hurt you too much at all. Okay. Just a little pinch. This is me mixing it. So the tattoo is a little needle stick. It is a dot of India ink, or right now we also have a hyperpigmented UV lighted pink ink that will shine when it's UV lighted. It is just a little drop of ink on the skin with a little tiny stick with a needle underneath the surface of their skin. It looks like a little freckle. It feels like a pinch, but I wouldn't necessarily say it hurts. If anyone has ever experienced a true tattoo, it is a moving needle that bounces up and down. I would think that that feels worse than this. This is just a little needle stick underneath the skin layer, so it doesn't go deep. It's not like if you were gonna puncture or take blood from somebody. Get some more alcohol. And there you go. Okay. It is that tiny. Just like a little freckle. How'd that feel?
Felt like nothing.
Fabulous.
Thank you.
You're welcome. I got into Penn medicine into radiation oncology because I had several family members that had breast cancer. My own mother was treated here for breast cancer. It was a very surreal and eye-opening experience to not only be working in radiation treating cancer patients, but to also be working with my mother, who was now my patient. She's a success story, as she has been in remission for over 15 years. And that was a setback. That was a hardship that she had, and I got to see it firsthand, but I also got to see her survival and how she is thriving now and enjoying retirement life, which without radiation and without any other form of surgery or chemo that these patients go through, she may not be here to live to tell me this. Come on in. Welcome to your setup and treat. I'm just going to ask you to take off your glasses and your mask and put them right here on the counter. Come on over to the machine. I'm going to have you have a seat right here. Again, the knee cushion is movable, so I can move it, and your head's going to go right back on the head cup when you had your simulation.
Yep. No.
We get what they're going through. We as therapists understand what they're going through, where their mentality is. If they come in angry, we get it's not intentional. We get that they're angry about their diagnosis or about their treatments. We understand if they are in acceptance, we try to help them expect what's happening. Most of the time I feel like you're going to get more of an anxious patient or a claustrophobic patient or a patient that is terrified. Let's go bring out our imagers. You're just going to hear them above you and on the side of you. Your pictures look great. I'm going to retract the panels down. I'm going to remove the gantry around you just to make sure everything clears. I want them to know that it'll be okay, and we are 100% here to support them, and we will do everything we can to support them. If we don't have the answer, we will find the answer.
We have a big team back there, and we like to take advantage of that because there's a lot of things here at Penn that we don't see in other places.
And I think what's really beautiful is that throughout the process and the care team and how we take care of you, throughout the whole journey, we're there every step of the way, and even after the fact, we're there with you every step of the way. We're able to cure a lot of diseases, and it's really beautiful to kind of see the progression of these patients when they come in first being scared and then come out feeling really relieved.
All right. You can sit on up. Put your arm over the front. Straight up. You can bring your feet on over, and there's your shoes. You all right, Dizzy?
Yeah, I feel good.
Great. Go ahead and step on down. And then we will see you tomorrow for your next treatment. All right. High five.